Hello all. Today we are going to discuss about prolapsed disc. I am Mrs. Colin, working as tutor in Triple College of Nursing. Objectives: at the end of the class, we will be able to discuss about definition, types of herniation, pathophysiology, clinical manifestations, diagnosis, management, which includes the medical and surgical management, and prevention of prolapsed disc. So moving on to the classes. Introduction. Prolapsed intervertebral disc, that is PIVD, commonly called as slipped disc, is a condition where the nucleus pulposus protrudes out through the annulus fibrosus. So it can compress the spinal nerves, causing pain and the other neurological deficits. It most commonly affects the lumbar region, that is the L4 to L5 and L5 to S1. Moving on to the definition, a prolapsed disc is the displacement of the disc material beyond the intervertebral disc space, resulting in the nerve root compression. Intervertebral disc disease is a common condition characterized by the breakdown of one or more of the disc that separates the bones of the spine, causing pain in the back or neck and frequently in the legs and arms. The intervertebral discs provide cushioning between the vertebrae and absorbs the pressure putting on the spine. So the components in the intervertebral disc includes the annulus fibrosus, which is the outer fibrous ring, and nucleus pulposus, which is the inner gelatinous core. So the functions of these components are the shock absorber, provides a flexibility to the spine. So the bulging disc includes the disc which extends outward. Protrusion means the nucleus which pushes but remains contained. Extrusion is the nucleus that breaks through the annulus and protrudes out. Sequestration, which is a free fragment in the spinal canal. So moving on to the types of herniation. First one, posterolateral disc herniation, central herniation, and lateral disc herniation. Types or stages of intervertebral disc prolapse includes disc bulge, where the annulus is intact and nucleus is displaced outward slightly. Next one, disc protrusion, which means annulus is weakened and nucleus is pushes further outside. Disc extrusion, which means nucleus will break through the annulus. Disc sequestration includes the nucleus material that separates and moves into the spinal canal. Moving on to the pathophysiology, loss of fluid in the intervertebral disc due to aging may cause disc to lose their elasticity, flexibility, and the shock absorbing abilities. So what happens is the disc will become thinner and the nucleus pulposus will start to dry and shrink. So this change will limit the disc ability to distribute the pressure between the vertebrae, and the pressure is then transferred to the annulus fibrosus, which causes progressive destruction. So when the disc is damaged, the nucleus pulposus may seep through the torn or stretched annulus, which is called as herniated disc, otherwise called as prolapsed disc. And the spinal nerves will emerge from the spinal column through an opening between the adjacent vertebrae. Herniated disc can press against the nerves, causing radiculopathy. So this is the image for prolapsed disc. Coming to the clinical manifestations. Clinical manifestations include lower back pain, radicular pain that radiates down the buttocks and below the knee along the distribution of the sciatic nerve. Reflexes may be depressed or absent, numbness and tingling, or muscle weakness in the legs, foot, or toes. Multiple nerve root compressions, which is called as cauda equina syndrome from a herniated disc, tumor, or an epidural abscess may be marked by the severe low back pain, brachialgia, which is a cervical disc, progressive weakness, increased pain, bowel and bladder incontinence. In severe cases, cauda equina syndrome may occur, which is the saddle anesthesia, urinary retention, bowel or bladder dysfunction, which is an emergency treatment. So, the symptoms of cauda equina syndrome may develop suddenly or evoke slowly over the time and may vary in the intensity. Diagnostic measures, history and physical examination. So, in history and physical examination, you must ask the patient to straight leg raise test can be done. LASIK sign, which is a clinical test for the lumbosacral nerve root irritation, which is also known as straight leg raise or SLR test. Neurological assessment can be done. X-rays, MRI, CT, myelogram, epidural venogram or discogram can be done. So the uses of discography includes to evaluate the equivocal abnormality which is seen in myelography, CT or MRI to isolate the symptomatic disc among multiple level abnormality, to diagnose the lateral disc herniation, to establish contained discogenic pain, and to select fusion levels to evaluate the previously operated spine. So this is the LASIK sign. You must ask the patient to lie down in the supine position. The thighs should be bent at a 90 degree and knees to be bent at 90 degree. Gradually extend the knee, keeping the hip flexed. So when there is a pain in the thigh which radiates down the leg, it is called as positive. Moving on to the medical management. Rest and immobilize the patient. Proper positioning on a firm mattress. Cervical pain may be rested and immobilized by the cervical collar, cervical traction or any brace. A collar will allow the maximal opening of the intervertebral foramina and holds the head in a neutral or slightly flexed position. The patient may have to wear the collar 24 hours a day during the actual phase. The skin under the collar is inspected for irritation. So after the patient is free of pain, cervical isometric exercises can be done to strengthen the neck muscles. Epidural steroid injections can be given in the severe cases. Lifestyle modifications like weight reduction and ergonomic adjustments to be done. Quit smoking. So these are certain exercises for the slip disc. So failure of these conservative therapy may lead to progressive neurological deficit. Severe pain will affect the quality of life and emergency condition includes the cauda equina syndrome. So the surgical procedures can be done are laminectomy or discectomy, which includes the removal of herniated portion, microdiscectomy, which is minimally invasive procedure, spinal fusion, artificial disc replacement. So chemonucleolysis includes using a chemical destruction of the nuclear pulposus, intradiscal injection of chemopipine which causes the hydrolysis of the symmetric protein of the nucleus pulposus. This causes decrease in the water binding capacity leading to the reduction in size and drying of the disc. So assess the patient for any past injuries to the neck because unresolved trauma can cause persistent discomfort, pain and tenderness. Assessment includes determining the onset, location and radiation of the pain, assess for paresthesia or any limited movement and diminished function of neck. It is important to determine whether the symptoms are bilateral with large herniations. Assess the muscle tone, tenderness and range of motions in neck and shoulders. Assess the mood and stress levels. Moving on to the prevention. Maintain proper posture, regular exercise, lift objects correctly, avoid prolonged sitting, use ergonomic chairs, maintain healthy body weight. Thank you all.